Die. Right in the middle of videos. Okay. Second part of this. Has the doctor had other patients that have... Really? Okay, let me pause this and fix it. Alright, I'm going to have to hold the tripod. Has the doctor had other patients that have used this medication? If so, how have they done? That is what I would be most curious about. But I don't know if the doctor would tell me the truth, but I would like to ask that question, and I would like to hear, like true experiences of people taking it. How is this medication monitored? That's important. Some of them may have to take your blood periodically. Some they can do a pee test, things like that. What tests will I need prior to taking this medication? I found out, on a side note, the other day, that before your doctor gives you any medications for psychosis, which I've had before, that they are supposed to give you blood tests to find out if your thyroid is working properly, which I've had problems with mine. I've been hyperthyroid before, and then 10 years, 12 years later, slightly hypothyroid. And they're supposed to test you for deficiencies in certain things. I'm not sure if they did that with me before they put me on, tried out antipsychotics on me a few years ago, 2004 through 2006, but nothing worked. So I wanted to talk to my doctor about my thyroid and vitamin deficiencies and stuff like that. I'm supposed to meet with my doctor for a checkup of the pneumonia, I think, on the 7th, which is like 10 days away. All right, back to the thing. How often will I need these tests while taking the medication? What symptoms indicate that the dosage should be changed or the medication stopped? So one thing that they put me on called Abilify was making my eye twitch, which I've had before when I was really stressed. So I was like, oh, maybe I just have a lot of stress in my life right now. Maybe that's gonna go away. Then my face started involuntarily like contracting and doing weird things. And then it was like moving down, like I was having problems in my arm and my hand. And the doctors didn't really warn me about this, but I was reading the side effects after that and found out that those are called extrapyramidal symptoms, and they can be permanent. And so I took myself off of Abilify. I try not to do that with any kind of psych meds because you could get suicidal, like with your anti-anxiety or antidepressant meds, but I was not gonna live. Oh, I was getting involuntary jaw movements, like from the Abilify, but it did go away. But I stopped taking it after like 2 days because it was causing that stuff. It was scaring me. And I told my doctors I did that, and I was like, and you can't put me back on it. And they said that I did the right thing in my circumstance. I'm not telling anyone else to do that. Talk to your doctor about it. Don't just take yourself off of medications. Where can I get more information about this medication? I wouldn't trust them to tell me that. I like to do my own research, which means reading those pamphlets that they give you and going online, which could be, you can get some anecdotal stuff that's not really true, but you can also get some really good information. So it's kind of hard to weigh it for yourself. So maybe you want to ask your doctor that. Ask the physician and or pharmacist if they have any printed information on this medication you can have to study. They're supposed to always give you that, I think. But maybe if I got this piece of paperwork from a workshop called WRAP, Wellness and Recovery Action Plan, I think was what it was about. And I have a whole book of like questionnaires like this, and they're mostly for you to fill out, but this would be one that you could fill out, or your doctor could, and you could talk to them about it. But like mentalhealthrecovery.com, this might be for a lot of people who are really, really incapacitated, and maybe they don't, I don't know how pharmacists treat people like that, but maybe they don't always give them the paperwork if they don't feel like they'll understand it or something. I don't know. I feel like my forehead looks huge right now. Okay, so what I have to do today is I am going to the housing authority to tell them that my income changed because I got on temporary assistance for needy families because L&I stopped paying me time loss on the 3rd of January. So I'm glad that TANF exists for times like this. But I have to go report the change of income to the housing authority because you're supposed to do that within 8 days of any change. And I'm going to do my Pilates